Hi, thank you for choosing Choices for your services. Today I'm going to discuss the medication abortion. Your medication abortion uses two different medicines taken 6 to 48 hours apart. To complete your abortion, you will receive the first medication, Mifeprex, in the clinic today. Mifeprex is a medication that stops the growth of the pregnancy. Mifeprex can cause uterine contractions and vaginal bleeding, but most people do not start cramping or bleeding with Mifeprex alone. You should only take Mifeprex if you're certain about your decision. Once taken, it cannot be reversed. The second medication, Misoprostol. Misoprostol will be taken 6 to 48 hours after the Mifeprex, but no later than 48 hours. Misoprostol is the medication that will complete your abortion. Many people begin to cramp and bleed within an hour of taking this medication. Misoprostol can be taken buccally or vaginally. I will cover both. The buccal route, you're going to take 2 misoprostol pills and put it on each side of your mouth, between your gum and cheek. While the pill sits, swallow what's on your tongue and in your saliva. After 30 minutes, swallow what is left of the pills with a drink of water. You'll need to put on a maxi pad because bleeding can start within 1 to 4 hours. Also note that the buccal route can cause nausea. Misoprostol can also be taken vaginally. The vaginal route, you'll need to wash your hands with soap and water. You can prop your leg up on the side of a tub and you'll insert 1 pill at a time as far up as it will go comfortably. Put on your maxi pad because bleeding can start within 1 to 4 hours. If you're 9 to 11 weeks or had little to no bleeding after 4 hours, you're going to take the second dose of the Misoprostol. If you're under 9 weeks and have had period-like bleeding or more after taking the first bottle of Misoprostol, you do not need to continue with the second bottle of Misoprostol, as the process is likely complete. Okay, let's talk pain control. Hydration is very important. Drinking water and warm tea will help alleviate some of your cramping. You will also be sent home with 1 bottle of ibuprofen and 1 bottle of promethazine. You can take 1 ibuprofen and 1 promethazine 30 minutes before taking your Misoprostol. Take 1 pill, wait a full 30 minutes, and then begin your Misoprostol. You can also apply a hot water bottle or heating pad. Taking a warm shower or even sitting on the toilet may be helpful. What can you expect? You will have bleeding similar to or heavier than your normal menstrual cycle. You will pass clots from the size of a grape to a lemon. This is a sign that the abortion is working. Your cramping will be mild to intense and very uncomfortable. You will bleed on and off for 2 weeks, but it should get lighter and lighter. You should have your normal period 4 to 8 weeks later. That period may or may not be heavier than usual. You may experience fever, chills, diarrhea, feeling sick at your stomach, nausea, or just feeling tired, but those all should resolve within 1 to 2 days. You can go back to your normal activity as soon as you feel up to it. We do encourage you to take it easy the day after, or 2 if you can, but avoid strenuous activities for up to a week. Let's talk about when to call the office. You should call the office if you have any of the following. If you vomit less than 15 minutes after taking the Mifeprex, if you have a fever of 100.4 or greater for 24 hours after taking the Misoprostol, your bleeding isn't getting any lighter after 1 week, you do not feel like you passed the pregnancy after 1 week, you do not feel that your pregnancy symptoms are resolving after 2 to 3 days, such as nausea and breast tenderness. Call anytime you have severe pain or cramping that doesn't get better with the pain medicine, rest, or a heating pad. If you've had enough bleeding to soak 2 maxi pads an hour for more than 2 hours, passing blood clots larger than a lemon for more than 2 hours, dizziness or vomiting lasting more than 2 hours, weakness, nausea, or diarrhea lasting more than a day. If you call, be prepared to give your name and date of birth, how many maxi pads you have used in the past hour, the phone number and name of an open drugstore that you can get to, your temperature in the past hour. Follow-up. You will receive a call from a doctor at Choices 3 to 4 days after your medication abortion. The call will come from a 417 area code. Questions will be asked about your bleeding, clots, pregnancy symptoms, and when to take a pregnancy test. This usually takes only about 2 to 5 minutes. This is also an opportunity to ask any questions you may have about the procedure. However, you do not have to wait for this call if you have concerns. Call us anytime you have concerns about anything. Thank you for choosing Choices.